Wendy Williams has just undergone a series of neurological tests, and reportedly, she still has a diagnosis of frontotemporal dementia. I'm Dr. Frita. I'm an MD who has been quadruple board certified, and I have questions. When we talk about frontotemporal dementia, we're talking about a dementia that gets worse over time. It typically presents in younger patients between the ages of 40 and 65, and these patients have cognitive impairment. They have memory loss. They have difficulty with executive functioning, meaning difficulty carrying out tasks like writing a check or remembering multi-step directions. With Wendy Williams, she was also diagnosed with primary progressive aphasia, progressive being the key word. With primary progressive aphasia, patients have difficulty with speech, difficulty with word finding, difficulty understanding language, difficulty expressing themselves clearly. Now, if you watched her docuseries that came out last year, Where is Wendy Williams?, then you may have observed that at that time, she did seem to have some issues with word finding sometimes, perhaps what appeared to be difficulty with memory. You will also recall that her son stated that he believed that he had once been told that she could have had alcohol-induced dementia. Now, Wendy has shared that she's had an issue with alcohol in the past, that she had some alcohol overuse. And if indeed she did have alcohol-induced dementia, you would expect her to have an improvement in her cognitive function over time, an improvement in her memory, an improvement in her speech. Now, fast forward. Since we saw that docuseries, Wendy Williams has done some relatively recent interviews. She had interviews with Don Lemon, The Breakfast Club, The View. And if you watch those, you will recall that she really did seem to have an improvement in her cognitive function. She seemed to have decent memory. She definitely seemed to understand language well, to express herself well. She was witty. She was improving. So I have questions. If Wendy Williams and her team decide to release her medical information, I want to know why, at least to the outside observer, does it seem like she's getting better and not worse if indeed she does have frontotemporal dementia? Who gave her the test? Which neurological tests were administered? Was there just one physician or were there multiple independent physicians? Was she on any type of medication or sedative during the test? Was her guardian, her estranged guardian, the one who was over her care during the time of the test? I want to know, how is it that the physicians were able to determine that she had frontotemporal dementia as opposed to alcohol-induced dementia? Why is it that she does not seem to be following the natural history of frontotemporal dementia? In order to watch my full 6-part series on what's happening with Wendy Williams' health, be sure to click the link in my bio and to visit drfrita.com.